Hi, welcome. So today we are going to talk about anatomy and physiology of the lungs. So digging in a little bit deeper into what those lungs actually do, what they look like, and everything like that. So let's dive in. So basic lung anatomy, you have your right lung and you have a left lung. So you have two lobes in each lung. You have an upper lobe and a lower lobe. Our right lung also has a middle lobe. And you might ask yourself, why? Why does the right lung only have a middle lobe and the left lung doesn't? Well, it's because of the heart. So the lungs sit around the heart, and the heart it doesn't actually sit in the middle of your chest. It's actually kind of off to the left a little bit. And so as a result, that left lung gets to hug in on it a little bit tighter. And so it's a little bit shorter so that there is space for that heart to go in there. You have your trachea and your bronchioles that come up, and then you kind of go from there. So let's dig in a little bit deeper. So you have your trachea, which is your windpipe, which is the thing that carries the airway that comes in. And then that comes down and it breaks off into your bronchioles. So you have your large bronchioles, and then from that, it breaks off even more into the lower bronchioles, and the segmented bronchioles, and the subsegmental bronchioles, and then the two part of the lobar bronchioles, and then finally you get out to your little bitty bronchioles. And at the end of those little bitty bronchioles, you'll get the alveolar ducts and the alveoli, which is actually where that lung exchange happens. So as you look at the lungs, you can see that you have your different lobes and the pieces that are there. And then you have the pleural and the pleural cavity, which is the lining and the outside of those lungs. And so you kind of have that. And so that's a lot of times if you see somebody has a pleural effusion, that's where it's happening. They're having an increased fluid buildup outside of there. And then the most important down here is your diaphragm. So you have your diaphragm, which is right here at the base of the lungs. So that is the muscle that does the breathing for you. So as your diaphragm contracts, it pulls down and it allows those lungs to expand. And then as it releases, it sends those lungs back up. And so that is the biggest muscle that we use when we're breathing. All right, so you have your upper airway. So upper airway is going to include your nose, your oral cavity, and your larynx. And that larynx is the separation point between your upper airway and the lower airway. So the larynx is where your vocal cords are connected. It also keeps the trachea and the esophagus separated in there, and it controls the airflow and tries to prevent anything from passing through to those lower airway passages as much as possible. And then you break down, you go into the alveoli after you get through bronchioles. Okay, so what does the nose do? It actually filters the air that you're breathing in. It allows to go through the hairs, which are the cilia that are in your nose, and the mucus in your nose that kind of trap all those things that could get in your nose and irritants to keep it from trying to go down. It also moistens the air, which is why it's connected to your throat through the back of your throat, because your mouth is going to have saliva in it, and that's going to really allow it to moisten it up. Also helps warm the air up. So that's why when you go outside in the colder weather, we tell you it's really important to make sure you're breathing in through your nose at that point, and you're wearing that warm muff so that you're not breathing in cold air. And the relative humidity that we're using through there is 75 to 80%. So we're really increasing that air capacity, or the moisture in the air. Your pharynx is your throat area. So what this does is it allows the larynx to pull forward, so that when you are swallowing, the food goes down the esophagus and not down into your trachea. And as you all know, this doesn't always work. You can't breathe and eat and inhale all at the same time. Or sometimes it goes down, we always tell you it goes down the wrong way. And oftentimes, most likely, it's going to be water that gets aspirated in there. And sometimes you can have food get aspirated down there, which is so dangerous. And while they do the swallow test and everything like that. So now we're going to talk a little bit more about the exchange of gases and how we actually breathe. So when you get everything into your lungs and we get all the way out, we break down, we actually end up at these tiny little sacs called the alveoli. And that's where we are now. So in these alveoli, and alveolus is an individual one, you have the capillary beds that line them. And those capillary beds at the very extreme is where that gas exchange happens. So you have the CO2 that comes back from the body, gets exhaled off, so it's collected through those veins of the capillaries and is released back into the alveoli, and you're able to pick up the oxygen in the alveoli. So that is actually where that gas exchange happens. And so it comes in via the pulmonary artery and it goes out via the pulmonary vein, remembering that the pulmonary artery is the only artery in the body that carries deoxygenated blood And the pulmonary vein is the only vein in the body that carries oxygenated blood, because arteries carry blood away from the heart and veins bring it back to the heart. And so you have mucus linings, mucus glands in there, you have your alveolar ducts, but the biggest thing is that it happens in these alveolar sacs at the capillary beds. So they are as small as a pinhead. They sit in sacs of 15 to 20 in a cluster. You have 300 million alveoli in your lungs, which is a huge surface area, being the small size of a pinhead. And if you were to take them all out and spread them out, they would be the size of a badminton court, or roughly the size of a pickleball court for some of you guys. And then they are as thin or as thick, depending on how you want to look at it, as a soap bubble or a tissue paper. Not even big enough for tissue paper. So they are very, very thin, which is why gas exchanges so easily happen in those locations. So bronchodilators. So that's one of the medications that you use often, especially if you're asthmatic or you have conditions. So if you look, you can see here in an airway that's being untreated. So everything is constricted. You're not getting a lot of gas exchange, but when we use these bronchodilators, they do exactly what the medication name says it does. It opens up those bronchioles. So you can see here, the little space that we had right here to breathe is now this big after those bronchodilators. So that's why it's so important to use those inhalers. And that emergency inhaler that you carry with you all the time, this is what it does. It's going to take those airways and open them all back up for you. All right, so let's dig in a little bit deeper about all the diseases a little bit here. So, and why they look different. So on the, I don't know my right and left, on this side you have a normal lung, and then over here we have what it looks like when it is different. So in this case we're looking at a picture of asthma, which is usually caused by muscle spasms or plugging mucus plugs. And so up in this top picture, you can see the cross section is a lot narrower. And oftentimes what this will cause is hyperinflation. So the mucus plugs will cause those not to work as well, and so you actually hyperinflate, and so you're not going to get the gas exchange to happen as well as in the cross section of the bronchioles. They're narrowed because of those mucus plugs, and then the muscle spasms are not going to allow them to exchange as well, that air movement. Next is bronchitis. So again, healthy lung over here, and bronchitis is over here, and you can immediately see the difference in the nice healthy airways here versus the bronchioles here are a little bit more inflamed. So bronchitis is irritants that have caused the mucus to thicken and pus and clog the airways. So these airways are really inflamed and irritated. And so you can see here the cilia are working nicely and cleaning everything, moving everything along, nice, clean, narrowed mucus plug. Over here you have a lot more inflation, and that mucus buildup is moving a lot more, and the cilia are also paralyzed, so they are not moving the way they are, and so you're not going to get that muscle, you're not going to get those tissues to move the way they should. And the inflammation is really the key here, and you can see that over here. All right, emphysema. So again, healthy lung, lung affected by emphysema. And this, what we really see are the ruptured alveoli, and so that's what you're kind of seeing here. It's not as pretty of a picture. The alveoli walls right here, you can see, are going to be ruptured, and so the size of the sac is increased. So you can see right here is the normal sac, and then outside is a lot bigger. Excuse me. And so you see that change happen where those alveoli are so damaged, they're not able to pick up the CO2 and pick up the oxygen and actually have that transfer happen efficiently. Then our last one for today that we're going to talk about, so again, is normal, and then we are looking at lung cancer today. So lung cancer is often, we see the masses form in the lungs. So you get those cancerous cells, you get the tumors that form, and so they disrupt the normal cell structure. And they can also partially block the airways, depending on where they are. So lung cancer can take many different forms. It can be in different parts of the lobes. Sometimes it can affect, it can wrap around those bronchioles. So depending on what kind of form you have, it can have different structural. But big thing about lung cancer is it changes the structure of those cells, which can then inhibit the breathing. So this is kind of just a brief overview of some of the mechanics and the physiology behind lungs. And so just let us know if you have any questions. Thank you for joining us today, and hope you guys have a great day.